Hello everyone, hi, I'm Dr. Priyanka and today I'm going to talk about deworming under the following headings. What is deworming? What are the benefits on the health? What medicine is to be given and why to give it even if your child is not having any signs or symptoms. And since deworming is to be done every 6 monthly, how do you remember the date? How can you remember it to be given regularly up to every 6 monthly? So I'll give you a tip about that too. Keep watching. So what is deworming exactly? So deworming is a process by which we kill the worms or kide, what we say in common language, which are residing inside our intestines, inside our body, and we have to do this periodically, that is every 6 monthly, and especially in children up to the age of 18 years. So one question which may arise in your mind is, doctor, why to be given only in children, or why children are more prone for this, and should even adults take it? So why children are more prone for this is because after the age of 6 months, 7 months, they have a peculiar habit of keeping everything in mouth, which is called mouthing in medical terms. So there is more likely that they will put unhygienic things, or even for the matter of soil, or some inedible things. Sometimes they tend to touch their own urine, or anything mud related stuff, soil, and they tend to put it in their mouth, which is one of the reason that younger children are more prone to take worm inside the mouth. And when it comes to older children, they are more likely to eat junk food. They are not so much conscious about their sanitation unless we teach them. So it's safe to deworm them. For adults, if you are eating outside food, yes, you should also deworm. So what is the effect of this worm infestation on our health? So these worms from the soil, they enter into our intestines through, obviously, we ingest them, and inside our intestines they tend to consume our nutrition, the food we take. The nutrient from that food is taken up by these worms, so we are devoid of that nutrient part. Also, they suck a lot of blood because they are parasites, so there is blood loss, and this can result in anemia, and over a long term they'll affect your health. They will cause poor nutrition, they will cause poor growth. So what is the medicine that you have to give for deworming? This medicine has to be given every 6 monthly in children. Even as adults, if you are taking deworming, you have to take it every 6 monthly. So albendazole is the name which you have to remember. Albendazole, I'm repeating it again, albendazole. So this comes as both syrup and as a tablet. 400 mg tablet comes in the market. Read the tablet name. It should not be a combination with any other drug. There's even a combination available with albendazole and ivermectin. Do not take that combination. Ask him for plain albendazole. Take a plain albendazole tablet. 400 mg tablet should be given to children about 2 years old, and even for adults. For children below 2 years, that is 1 to 2 years of age, should be getting 200 mg, that is half tablet. Or you can also give a syrup. 10 ml syrup contains 400 mg, so 5 ml syrup has to be given to children below 2 years of age. This has to be taken every 6 monthly. I have repeated it again to emphasize that every 6 monthly you have to give it to your children. And even if you, as an adult, if you are taking outside food, you have to take it every 6 monthly. Some parents ask, doctor, why should I treat my child if there is no signs and symptom? He is not having any abdominal pain. I cannot see any worms in his potty. So why should I treat? What is the need to be given? So worm infestation, or if you have worms inside your body, it is not going to cause any immediate effect. Obviously the worms are going to grow from their eggs, and they'll have to suck enough blood for them to cause blood loss, for it to manifest as anemia. They have to suck enough nutrients from the your food, and it will take a long time to manifest in the form of poor growth, poor nutrition. So the second important reason why you should do deworming is the treatment cost is much more than the prevention cost or the deworming cost. And for that matter, any disease, the prevention cost is always 1/10 of the treatment cost. So it is always wiser to go for prevention than for the treatment. So it will be wise to do the deworming rather than waiting that if my child develops worm infestation, I'll get him treated. No, that's not wise. Third important reason is the drug that we are giving for the preventive therapy or for the deworming, that is albendazole, is a very safe drug and has minimum side effects. So one of the practical problems of our busy life schedule is we tend to forget. Many parents ask me ki, how do I remember that every 6 monthly I have to give albendazole to my child for deworming. So I can tell you how I remember it. So all of us remember our child's birthday, isn't it? That's a special day for us. So you just have to remember that birthday 6 monthly. For example, my child's birthday is on 17th October. So I remember it 6 monthly, that is even on 17 October and in April 17. So these are the 2 days when I give him the deworming dose. So you can also remember like that. Thank you.